There was a trial called the ATAC trial that was reported in 2005, whose findings were that in postmenopausal women, in the adjuvant therapy of breast cancer, 5 years of an aromatase inhibitor was slightly better than 5 years of tamoxifen. That trial has now been updated to about year 9, and the 3 to 4% benefit has held up with the aromatase inhibitor. But interestingly, at year 9, there does not appear to be a survival benefit with the aromatase inhibitor patients versus the tamoxifen patients. The most important thing is that the patient be on some kind of therapy. There are clearly at least 5 or 10% of women who have so much toxicity with aromatase inhibitors that asking them to continue that for 5 years just doesn't make any sense. The most common toxicity would be joint pain and muscle pain. In those patients, I think it's quite reasonable that rather than have them stop taking the drug and not be on anything, to switch those patients to tamoxifen, because the tamoxifen was actually not that much worse than the aromatase inhibitor. So if one is having a lot of trouble with the aromatase inhibitor, one should discuss with their oncologist the possibility of switching to tamoxifen, which certainly gets away from the muscle and joint issues. It may result in some hot flashes and night sweats, but in my experience, patients that have switched from an aromatase inhibitor to tamoxifen generally find that much more tolerable.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.